The divide in healthcare beliefs, a troubling trend. In a recent poll, a staggering 59% of Americans expressed disapproval towards RFK Jr.'s actions as the health secretary. This statistic reveals a deep partisan divide, with Republicans trusting Kennedy as much as their own doctors, while Democrats and independents hold a starkly different view. But here's where it gets controversial. The same poll highlights how personal beliefs about health are increasingly influenced by political leanings. Take, for instance, President Trump's warning about acetaminophen, the active ingredient in Tylenol. A day after his statement, KFF, a nonpartisan health research organization, conducted a poll. The results? Democrats overwhelmingly, 59%, believe Trump's claims were false, while Republicans, 56%, largely accepted them as true. And this is the part most people miss. There is no scientific evidence linking acetaminophen to autism. Yet, Trump's unusual press conference last month advised pregnant women to avoid this common pain reliever. Meanwhile, medical experts continue to emphasize its safety during pregnancy. The poll's findings offer a glimpse into the changing landscape of public opinion and federal health policies. It reveals a concerning decline in trust for the Centers for Disease Control and Prevention, CDC, particularly among Democrats, as the Trump administration dismantles many of its mandates. In just 2 years, trust in the CDC's vaccine information among Democrats has dropped by a significant 24%. Historically, polls have shown that people trust their doctors above all else for health advice. However, with the appointment of RFK Jr. as the health secretary, party lines are now a critical factor in determining trusted sources of health information. Republicans, for example, trust RFK Jr. as much as their healthcare providers. Despite this trust from Republicans, Kennedy's overall job approval rating is low, with 59% of people disapproving, mainly Democrats and independents. As faith in federal health agencies wavers, people are turning to diverse sources for health information. Democrats are relying on professional medical groups like the American Medical Association, AMA, with over 80% expressing trust in these organizations. In contrast, only about half of Republicans trust the AMA or the American Academy of Pediatrics. This fragmentation in the public health landscape means people are making choices based on vastly different beliefs. As people turn to various sources for health decisions, partisanship will likely play an increasingly significant role. So, what do you think? Is this a concerning trend? Should we be more mindful of where we get our health information from? Feel free to share your thoughts in the comments below.